a veterinary technician for 20 years in April, so it's a pretty exact 20 years. I don't know everything. I learned a lot the hard way. I actually started out my journey in horses with sick horses. I didn't own my own horse until after I had been working in the field for about 3 years. So when I first got, my sister, I think many of you know my sister Laura DeFazio. Laura's had horses since she was 16. Instead of buying a cart, she bought a chestnut thoroughbred mare. So was it the wisest decision? Probably not at the time, but the mare's still kicking and it was worked out for the best. But when I first got a healthy, nice riding horse, I really kind of didn't know what to do with them. I'm like, okay, I guess I should check your vitals, check your temperature. Like, oh, you're healthy. What do I do with you? So, but anyway, I still have him. He's retired. And then as he retired, I kind of followed in my little sister's footsteps and got into driving. And I think I've kind of found my niche with my little guys. So they've all started from the ground up, from the new Bolton herd. They come out kind of like the acetique ponies. They know what people are. They associate them with things like food, but they don't know what a halter is or anything like that. So as long as you keep things positive, they'll do anything for you, including driving straight into the rain at a place they've never been to. So, but today I figured I'd talk a little bit. I know some of you have had horses forever and you probably are pretty savvy knowing your horses and some basic medical care. But I'm still surprised at so many people that, you know, want to know a little bit more or don't feel like they know enough to be comfortable to talk to their vet. So I figured we'd go over some basics, kind of like how to do a good thorough physical on your horse, some things to have on hand, kind of having a plan, some kind of true emergency scenarios and how you should respond. And then I'm going to talk a little bit about biosecurity, which I think Tracy and I started talking about this talk at the holiday party last year, but I think biosecurity is now a topic with COVID that we're hearing a lot more about. So just being biosecure with our horses. I spend majority of my time spent is in our GI critical care. So I spend a lot of times with colics, a lot of times with isolated cases, not so savvy with sports medicine, lameness things. But Erin, who actually lives here at the farm, is another nurse that I work with. She's a little more nichey into that. So I can tell, yeah, the horse looks off, but that's about where it stops with me. But if it's a colic, that's where I kind of really thrive. So starting out, and I'll mention this a couple times, you all know your horse. Know your horse, know their vitals, know what's normal for them, and that's going to, and if you can communicate that, it's going to help your veterinarian and it's going to help in the long run. Because if you have to take their temperature, you don't really know if that's normal for them, because there's a pretty large range with things like temperature or heart rate. And I do mention on here, I kind of put together a little outline, but I don't know how many people here are breeding or have foals on your farm, but the vitals of foals are going to be dramatically different. They're going to be higher, especially the first few months of age. So where with a foal, if you could have a heart rate of 80 to 100 is normal, especially if they're up and active. But if that was a horse, they could be on the verge of dying for an adult. But for a foal, it's normal. And then some of the smaller breeds, like you're mentioning the minis tend to have some higher resting vitals as well. So their natural heart rate could be a little bit higher, whereas some of your drafty breeds, if anyone has any Percherons or Clydesdales, they tend to be on the lower side. So it's another good thing. It's kind of hard to make a full blanket statement of everyone's heart rate or temperature or respiratory rate should be this, because you have a little bit of variance. And things as you're communicating with people about your horses, we refer to it as mentation. Is your horse typically very quiet, stands out there? Like we have a horse at our barn, I mean, his name should be Eeyore. He stands out there, he's quiet, he's always by himself. Even if he's excited, he doesn't show it. If someone came out there to visit our barn, they'd be like, oh, that horse doesn't look good. What's wrong with him? but that's him. So that would be helpful to point out if he's, you know, has to be evaluated by the doctor, or if he's in the hospital, that he's just naturally quiet. And then there are other horses that run around like a lunatic all the time. They're pacing, they're stall walking, weaving, need to have a friend. If that's normal for them, you know, to someone else, they might say, oh, that horse is super anxious, something's wrong, something's bothering it. But if you know your horse, you just say, that's her, half hour, she'll be fine. So having that, knowing that baseline and be able to communicate, that's important. Even something as silly as knowing about your horse's manure production will help you to know, like if they always pass 5 piles every night, the back corner of the stall. Just kind of knowing that will help you for if you go in one morning and it's looser than normal, or if it's not as much as normal, that could sometimes tip you off to something starting, a problem could be brewing. Temperature range is pretty broad, 99 to 101. Typically in the hospital, once we start getting closer to 101.5, we start to be pretty concerned about a fever. But once again, know your horse's normal values. Just, I know with COVID, I've got to take my temperature every day, and I know what my normal is. It could be a whole degree off from someone else, but that's normal for me. So I know that, and I'm not worried, where someone else might say, oh, you're running a little low or you're running a little high. Pulse or heart rate, once again, you've got a big variance. Your Pertron might have a heart rate of 32 beats per minute. Your Mini, it might be closer to 50. And that's just normal and based on size, whereas your normal thoroughbreds, quarter horses, Morgans, they might be right around 40. And I put the little diagram down here too to just key out, hone into a few spots where we're going to listen or observe for some of these vitals. In my second list where it says what to have on hand, you can go to any tack shop or even order online. You can get a really cheap $10 or $15 stethoscope, and that will make it super easy to listen to your horse's heart. You should be able to count the beats, and you can also use that stethoscope to listen to their gut, which I have down here, like letter G is where you listen for gut motility, or borborygmi is the fancy word. Could be a Jeopardy question one day. What is borborygmi? It's, you know, gut sounds. And when you're listening to that, it should sound kind of like your stomach's gurgling. And you should, if you're listening for about 15 or 30 seconds, you should hear at least 2 to 3 good gurgles. If you hear nothing, then that could be a sign that maybe they have an impaction or something's not moving. And if you're listening and it sounds like a dishwasher or a washing machine, it could mean that they could be developing a colitis and they might end up with some diarrhea or some loose manure. So where we listen, I put another diagram, I think it's on page 3, but where we listen can kind of hone you into what part of the GI anatomy you're not hearing things move, or things are moving a little bit more than they should be. So, and things like this are helpful if your horse doesn't look right. You do a quick one over. When you call the vet, you can say, okay, his heart rate is high for him, it's 48. His temperature is a little high, or I listen to his gut and I don't hear anything. That's going to be helpful information. Your vet is going to repeat that when they come out, but it's still good to be able to communicate that. So the more you know, sometimes more it can help your horse. Even looking at their gums, a lot of people, if they're used to looking at their dog's gums when they pant, dogs' gums tend to be a little brighter pink than horses. So sometimes if you're looking at a horse's gums, they might be a little on the paler side. But just get a baseline, like when you're putting the bit in. Okay, this is what his gums always look like, and then that way you'll know if he's looking a little pale one day, or if his gums look really bright, which could be a sign that he's not feeling well. And if you touch his gums, the color should pop back where you touch in about 2 seconds or less, and that's what we refer to as capillary refill time. That kind of tells us that they're hydrated. So if your horse isn't drinking a whole lot, you feel their gums, they feel dry, the color doesn't come back to them in a couple seconds, they could be dehydrated. We talked about those GI sounds a little bit, and even I put distension on here. So working at New Bolton, we're a referral clinic, we see lots of emergencies, and with COVID it's a little different, but typically we have horses that come in with shippers or with trainers, with owners. It's helpful if you are with someone who knows that horse, because if they come in and they look really round to us, we want to know, okay, is this what Spot typically looks like, or like is he just a little heavier, or do you think that he's distended for him? So it's nice to know, oh yeah, he looks like he ate a beach ball. This isn't his normal. Whereas if you saw one of my ponies, I'd say, yeah, they ate the beach ball. They're not distended, they're just a little large, but it's good to know. So, and then also, especially in light, I think a lot of horses are living a lot longer than they used to, which is great. They're also developing more metabolic diseases, so they're a little more sensitive to things like sugars, and that can affect their feet. Laminitis is very prevalent in the horse industry. We have a whole lab dedicated to try and figure out more about it, how to prevent it, how to treat it. But laminitis is just when the tissue, there's interlocking tissue between the hoof wall that we see and the tissue that's surrounding their coffin bone, which is the bone that's actually in their hoof capsule. So any kind of inflammation, which can be triggered by metabolic disease, can start to separate that tissue, and then that's when you hear of terms like they're foundering, they're rotating, and it's literally there's not enough support around their coffin bone, so their foot starts to rotate within the hoof capsule, and looking at the bottom of the horse's foot, their sole is very sensitive, and every once in a while their coffin bone could make contact or try and come through the sole of their foot. So if you see your horse acting sore, and it's not just you rule out your abscess or other reasons of lameness, it's really great to get them evaluated to make sure that they are not becoming laminitic or foundering. Very easy to detect on x-rays, which your vets can do right at the barn. But something that's also good to have a baseline is just temperature of the hoof. So just feeling a lot of you, I know with me, every time I'm picking my horse's feet, I feel down their legs, make sure nothing's swollen or hot or sensitive. And then right when you get to their coronary band, where their hoof starts, just making sure everything feels normal all the way around, making sure nothing's really hot or cold. Now, you say, but if it's really hot outside, or if they've just been standing in snow, they might be a little hotter or cold. But as long as everything is pretty similar and pretty consistent for that horse, you're good. And also, like right behind the pastern, so right below the fetlock, horses have two arteries that run down the back of their leg there, down to their foot. And it's quite the skill to learn how to palpate these, but if you're ever feeling down their legs and you feel a pulse bounding, that could mean that your horse has some kind of inflammation in its feet, and could be telling you that there's some laminitis brewing. I always kind of compare it, if you put your finger up to like your temple, you should be able to feel your own subtle pulse. But if you've got a migraine or like a horrible headache, or you're really stressed, you kind of feel your pulse bounding out of your head. You don't want to feel that in your horse's leg or foot. Now, if they've just come off running cross country, it's a different story. But just have a baseline of your normal horse coming out of the stall, coming out of the field, and then that way, as you're checking them daily, if something doesn't feel right, you know. Because at the veterinary hospital, we know what's normal and abnormal all day long, but you guys are the experts with your own horse as far as knowing he's not right, this isn't right, this isn't normal. So we go very heavily off of that. So, which is once again, like this isn't, doing a physical isn't a, instead of calling your vet, it's just something that was going to, that you'll have in your toolbox to be able to communicate with your vet. So, any questions on that? Okay. Supplies, I'm sure you all have these, a lot of these supplies around your barn and then some, but keep a really inexpensive digital thermometer around. You can use one of the old mercury ones too if you want, but the new digital ones work really well. Inexpensive stethoscope. Like I said, you can get one at a tack shop, $10, $15. You don't have to have anything fancy. But just to be able to, and practice listening to your horse's heart. It's going to sound slow. You'll hear a lub dub, lub dub, lub dub. That's a full heart sound. So just get practice listening to it. Roll cotton is great to have on hand, especially if there's any injury to the limb. Some gauze, vet wrap, duct tape. You never know when you're going to need duct tape. It's kind of the joke that it fixes everything, but I mean, people have had to, it does. People have had to, you know, if a shoe comes off or partially off, they rip a hoof off, have duct tape. In some really horrible cases, I've had people that have, their horse has fractured its leg, and to makeshift a splint, they've used a piece of wood and duct tape to secure the limb with their veterinarian, but their veterinarian didn't have the type of splint that they needed. So duct tape is great to have around. Saline Eyewash, especially this time of year, I feel like with all of the pollen, there's a lot of allergies. So some horses might just have allergy eyes, or if they do get something in there, it's always good to have a saline wash. You can wash out and see what's going on. And it's nothing fancy. Just go, you know, go to Walmart, go to the dollar store. You don't have to spend a lot of money on any of this stuff. Some iodine or betadine, which is great for scrubbing out small wounds. Not in the eyes. Even a good old standing wrap, having a set of them, you can use those as a bandage over a little bit of gauze. Keeps things clean, keeps things supported. Gloves. And then depending on your barn or your setup, how large it is and what your comfort level is, a few nice things to have is maybe a sedative. A lot of times veterinarians will dispense and let you have a small bottle of a sedation, even like acepromazine. Some horses need it for the farrier, for the dentist. Some horses need a little bit of it just to get out on a trail. Something like that's nice to have in an emergency basis. Some non-steroidal anti-inflammatories, which this is bute, banamine. You know, if the horse is just, they're a little lame, they worked a little too hard, are good to have. A big message, and I don't know how many, it's on the label of banamine, which the drug, actual drug is flunixin meglumine, but everyone knows it as banamine, so we mention it as banamine. On the label, I believe it still says, I don't know if Aaron, if you've seen it.
The last bottle I've seen, yes.
Yeah, it will say that you can still give it in the muscle. Don't give banamine in your horse's muscle. So what happens is banamine is one of the medication that is very irritating to the muscles of the horse. And horses, I mean, they live outside, so there's a lot of spores and bacteria and stuff that just lives on their skin because they're living out and amongst the soil. Clostridium is a spore that lives in some of the soil. It can live on their hair coat, and it's very opportunistic. So if you give banamine in the muscle is, even though it's an anti-inflammatory medication, it will cause kind of a little reaction within the muscle, irritate it enough for this bacteria to get in there. And what Clostridium does, it's the same, not necessarily the same strain, but it's the same organism that causes things like botulism and tetanus. But Clostridium hates air, so it burrows down into the muscle where there's no air, and it causes a major infection. And it basically is it causes muscle necrosis. So necrosis is dying, so it basically kills off the muscle. And it's always seen, like, I've never seen it with anything other than Banamine, but it can be seen with, like, there are a few other injections. I just looked at the list the other day, but like vitamin injections and things like that. But Banamine's something that a lot of people have in their toolbox arsenal at home. You can give it orally. You can even give the injectable kind that you have orally at the same dose. So if you don't have paste available, just don't give it in your muscle. It can go in the vein if you're comfortable, or a friend is comfortable, or your vet could even give yours that, you know, at a discount because you're producing the medication. But just, I've seen enough horses that come in with this condition. The treatment isn't pretty because you have to slice, it's usually in their neck. You have to slice into their neck. You have to open that muscle up to the air. They're very stiff, they're very sore when they come in, they can seem really colicky. But if you take home anything from this, just, I don't know how many people are still giving it in the muscle. Like I said, the bottle says that it's okay. Just don't listen to the bottle. And so, and I included this little skeletal diagram. That's okay. I've included this little skeletal diagram on here because a lot of injections in the muscle will give in the neck just because it's a little safer than sticking them in the behind. But if you look at the diagram, horses' cervical vertebrae, so like the vertebrae in their neck, like our neck, it kind of does a little dip down. So a horse's cervical spine doesn't go straight across their neck like some people think. Actually, under the mane at the top of their neck, that's actually a really thick ligament called the Nuchal Ligament, and that is what's responsible for supporting their head. So when you're giving an injection, you just don't want to give it too far down on the neck where the spine is. You want to avoid giving it right under where the mane is. You can usually feel a really thick ligament there, or you can appreciate how it feels thicker than the middle of their neck. And then you just, as you get further back in their shoulder, obviously you wouldn't inject into that bone there. So I added that diagram just because if you give an injection too low in the neck into the spine, that's when you could have an accidental meningitis, or you could end up causing more harm than good. So plus the diagram's pretty cool. It kind of shows some other good structures as you're talking, like I said, as you're talking to your vet. And this is kind of nice because it gives you a little bit of like the lay terminology plus some of the medical terminology. You know, like if you're talking to your vet, like, you know, doc, his knee is swollen. Well, the knee that you're referring to is probably the carpus, which is in the front of the horse's, in one of their forelimbs, where actually their true knee is in the back, is their stifle. So, so I kind of like this diagram because it kind of gives you both terminologies. And then some other things to have on hand, and like I've learned some of this the hard way. I always keep a little bit of well, one of my ponies lives on Zyrtec. Luckily he's little, but cetirizine you can get really cheap generic. This is really great and came in handy when two of our ponies were stung. They got into a little nest of bees and they had stings all over them. They were running around. We cold hosed them, and you know, I called one of the girls at work. I'm like, what can I do? Can I give them anything? And she's like, get some Zyrtec into them. And they were fine within probably a half hour. So it's just an antihistamine. It's, you know, people take it for allergies every day. Sometimes if I get desperate, I break into my husband's stash. He's like, I thought I had a year's supply of Zyrtec. I'm like,
You did.
Muggles needed to borrow a few.
How much did you give them?
I give my guys, they're about 450 pounds. Muggles gets 8 of them. He can get them up to twice a day. So I forget the actual dosage, but I could get that. But they're about a half a horse, and he gets about 8. So
I've got 1,100 pounds. They told me to start with 10. I can go back from there.
yeah, that's a pretty broad
10
range
twice
too.
a day.
Yeah,
So 20 a day.
yeah.
Can you ever inject them with an EpiPen?
I would not advise
Do
that. Yeah,
It's better
I don't
to
think
use
you could get a
resistant.
high enough, or yeah, I would not do epi.
Is Benadryl the same?
Benadryl is not the same. You can give Benadryl, I just don't know that dose, but the cetirizine works really, really well, and I think it's even cheaper than Benadryl. So, but
You
yeah,
can get the generic at like BJ's.
yeah, I get it on Amazon. It's yeah,
Yeah. You can get generic
I get-
Zyrtec on
Yeah.
Amazon, at BJ's, any of your big clubhouses.
yeah.
Because when you're going through 20 a day times 30 days.
Knock
you
on
get it
wood,
for,
I haven't had to use it.
You know, $14.99 versus $40.99. It's
Yeah.
ridiculous.
Yeah, don't buy it at CVS or Walmart or any of those places. Get
Unless
it.
you have an emergency.
Yeah, exactly. Or you raid your spouses. And then electrolytes are also good to have, especially I think a lot of people feed electrolytes on a fairly daily basis, or if you don't, just to have a little bit on hand in case your horse isn't drinking. If they're not drinking and you don't have electrolytes, you can even do, like, sometimes in the hospital we'll make what we call sweet tea, put a little bit of sweet feed in their bucket or a little bit of molasses, and sometimes that encourages them to drink. Especially when it's really hot, they're not feeling well, you need to get really creative.
A little bit of maple syrup.
You could probably use anything
the
to
water?
get them to drink. Yeah,
Like throw
just
it in
mix
the
it in their water. Yep. And people, it always throws our vet students off because they're like, so we have to give this horse sweet tea. Do I have to go down to Landhope? And then we're like, no. Here, we'll show you. It looks like they pooped in their bucket, but some drink it, some don't. Some end up dumping their bucket because they want to get to the grain at the bottom.
Some like Gatorade too.
Yeah, even Gatorade. Yeah.
Dilute that in a bucket of water or something, gives them a little flavor. I mean, depends on their taste preferences, obviously.
And if you have any pigs at home, pigs really like Gatorade too. we work with lots of species. So yeah, I mean, it's always, if you have more, you can keep more things in your arsenal, but you know, having the anti-inflammatory, having a little sedative, having an antihistamine, and some good electrolytes are kind of a good start for a medical stockpile. For things like, if your horse is really sick, you really don't know what's going on, I would still start with your veterinarian. Like, you know, hey, Spot isn't really himself, he's got a fever, or if it's a horse that's a chronic colicer, you could call your vet and say, hey, he's kind of doing this again. He may have responded to Banamine in the past, then you could give it. But it's still good to touch base with your doctor, especially if things escalate. And certainly if things do escalate and the doctor has to come out, communicate with them and let them know what you gave, because there are some medications like the Banamine that can only be given twice a day. They can be really rough on their kidneys, and it's one of the questions we ask when a horse gets referred in: have you given any medication? Because we don't want to repeat something if it's been too soon, and we don't want to compromise any of their organs. So okay, and just as like a little recap, you know, have your plan, know your horse's normals, have a veterinarian's number handy, or, you know, have a referral center. You know, obviously I work at New Bolton, it's great. There's Mid-Atlantic, which is up in New Jersey. You're down in Virginia, right? Are you in Virginia now?
No, I'm in Westchester.
You're still in Westchester, okay. Someone I was talking to was in Virginia, but you know, just have a handy,
Manor
have,
Equine.
what's that?
Manor Equine.
Manners, okay. Yeah, just have a referral number on hand with your regular vet's information. And also kind of have a transportation plan. I know a lot of people have their own trailers. If you don't, I mean, have a few transport companies information handy. you do have to get your horse somewhere, you don't want to be scrambling at the last minute. I know our front desk has a few numbers handy, so if someone calls and they're in a real pinch, we can usually get them in touch with someone who can get their animal into us. And yeah, and when you're transporting your horse in, try not to change anything up. It's not really the time to, oh, let's use the new trailer they're not used to. Try not to add any level of excitement to their lives, because we all know how some don't care, others, like, you could wear a different colored shirt and it completely rocks their world. So and then I was just going to go through a little bit with kind of some true emergencies or some emergency categories to keep on your radar. But the biggest thing, and I hope people say this with every emergency, stay calm, don't scream, try not to get frazzled. Remember, horses are flight animals. It's their natural response to get scared and run. Either run away or run into you to get away. So just even the calmest of horses, if they're in a situation where they don't have control over where they are, who they're with, especially if you're at a show, they don't know where they can get away to, where they can go. Just staying calm will help them 100-fold. Colic I put on here, and remember, colic is very broad. The definition of colic is just abdominal discomfort. We had a horse that came in the other day that was colicky, but it was really, he had poor blood flow to his kidneys. So his kidneys hurt him, but he appeared colicky. So, but 99% of the time when a colic comes in with a horse, it's usually a GI related problem, but it doesn't mean that it can't be something else. It could be, and colic is a wide range. It could be that they just didn't drink enough water, they've got a little impaction. Your vet can come out to the barn, can give them some fluids through a tube, can walk them, and you can work through it. Some older horses might have like lipomas, which are little fatty tumors which grow inside. They can wrap around the small intestine. Those horses can be pretty painful, and that's a surgical problem. So it's a very wide range of what they can do. And on that third page, I kind of put a picture just for reference as to like their GI anatomy. They've got 100 feet where things could go wrong, and they find a lot of really creative ways for things to go wrong. Their large colon, which should sit in their ventral abdomen or down at the bottom, sometimes it can swing up to the left and can get caught up by their kidney along their back. Sometimes it swings up on the right, and that's usually when you'll hear the term a volvulus, which happens a lot in mares after they foal, because like they just had 120 pound foal come out of them, and there's a lot of room in there for their gut to do activities. Those, especially when it twists to the right and really twists on itself, that is fully surgical. But sometimes if they're just a little displaced, you can medically treat them. A lot of times when impactions happen, it can happen in the cecum, which is in their hindgut, or their small colon, which is kind of on the way out. And not to discount, some impactions are super painful and still require surgery. A good gauge for us, if we have a horse that's in that we keep sedating and the horse is not comfortable to the point where they're going to hurt themselves or hurt someone, that's usually an indication that they need surgery. But it's, like I said, it's hard to fully diagnose colic until you're in their abdomen. So the doctors can usually say, this is what I can feel on rectal, I can't feel his kidney, I think that his colon's in the way, or they can feel an impaction. They'll start their treatment based on that, but it's still not a definitive because you're not in them. You can do ultrasound, you can do things like that, which can give you a pretty good idea of what's going on. But sometimes you just can't, like I said, with 100 feet in there, a lot can go wrong. Those little fatty tumors like to live in their small intestine, and that can be very tightly knit, and it can kind of be hard to see what's going on. So if your horse is colicky, definitely do a physical exam, get your vet out. They'll see if they can feel anything on rectal exam, especially if the horse looks very painful, doesn't want to get up, super sweaty. Because remember, horses cannot vomit. So if horses have something obstructing their GI, or if they're, nothing can get out of their stomach, it's a true emergency to get a tube down to alleviate gas or fluid or any pressure. Because if any part of their GI system ruptures or leaks, there's no saving them. It doesn't matter. We've had people, I have $500,000, save my horse. You can't, because you cannot effectively take the contents out of the abdomen, flush everything. You can't avoid an infection once the intestine leaks and you've got basically manure floating around in their abdomen. They're just too large. If it was a dog, if it was a cat, a person, yes. But there's too much going on here. You just can't save them when they get to that point. So it's why, Aaron and I at work, it's, one of the skills that we learned and do on a daily basis. Something's not right, we'll start there, because, if something happens and they rupture, you can't go back from that. So certainly if they seem in distress, get your vet out. They can pass that tube and try and figure out what's going on. So that's your fun fact on their GI tract. Eyes are always an emergency, and they might not necessarily be an emergency, take them somewhere, but even if your horse has weepy eyes, or like allergy eyes, mine, it seems like every other day a different pony has a swollen eye. Could just be from dust or pollen. I give them some Zyrtec, I flush it out, I put some triple antibiotic ointment in there. But if they didn't respond to that, you have to be careful, because if they're really itchy, you don't want them to come over here and say, oh, my eye's really itchy. They're going to start scratching up against something they shouldn't, and the next thing you know, you've got a wound around their eye, or they get a splinter in their eye, and they'll end up with an ulcer. So you can try putting eye cups on them or fly masks to try and deter them from causing self-harm. If you don't think it's allergies, but you go out, they're squinty, their eyes are tearing, get that evaluated. Some even small ulcers on their eye, you may not be able to see with your naked eye, so it's really important to get the vet out to stain the eye. And if you catch it early enough, then hopefully it's just, here are a few topical medications to put in and you'll be fine. But you can run into the problem where, the cornea gets so bothered and infected that sometimes they lose their cornea. And that's, one of the things we do are corneal transplants, but you don't want your horse to get to that point. So even if you're like, oh, there's just a small little cloudy spot, even if it was my horse, I'd see a small cloudy spot and I'm calling up our field service to get someone out. Even if it's nothing, you want to make sure it's nothing. So sometimes in a happy turn of events, they come out, you pay for a field call, and they say, oh, that's just an old scar. His eye was just runny because it seems like he's got allergies. Okay. In my opinion, that's money well spent, rather than, I let it go a few days and then, it's going to cost hundreds of dollars and he might not even be able to see out of that eye later. So yeah, always evaluate and get eyes taken care of. Lacerations, this category is as broad as it is long, but anything that's lacerated over a joint, so if anything's like, over the knee, the carpus, fetlock, anything that's over a joint, keep a real close eye on, because if that laceration is a little deeper than you think and goes into the joint, or even like close to a tendon or a tendon sheath, that can cause major problems. Street nails are just a general term for anything that the horse steps on that penetrates the sole of their foot. With those, it's really important if your horse, they're dead lame, you look at their foot, you see something puncturing, wrap it and call your vet. Don't pull that nail or screw or piece out if you can help it, unless it's like sticking out inches long. If you can, even cut it, because the problem, or if you do have to pull it and wrap the foot right away, because the problem is, the dirt, bacteria gets up in there, and if that communicates with the joint that's in their foot, then that can be a pretty big problem. So it's really important to remember that. That's where your duct tape comes in handy. I think we all know, no hoof, no horse, so want to protect their feet. Fractures, this is a big thing too. If you're in the unfortunate circumstance where you're with your horse and you're like, I just heard a break, or another horse kicked them, I heard it, or you go out and there's a limb dangling, unfortunately, have someone evaluate them at the farm before saying, we have to take him to New Bolton, we have to take him to Mid-Atlantic. Because depending on where the fracture is, getting it stable with some sort of a splint or a bandage is like detrimental, or could be detrimental. Could be detrimental if you don't get it wrapped or secured, but it could be, life and death sometimes, rather than just getting them on a trailer without it properly bandaged or stabilized. So they can take, usually your vet will just take x-rays at the farm. They can let you know kind of preliminary if you want to pursue getting that fixed, and then if you do, like I said, just getting it properly splinted and bandaged is the best bet for getting your horse to where it can be evaluated. Diarrhea. Especially we're kind of coming out of Potomac horse fever season, but a lot of summer bacterias will cause a colitis or a diarrhea in horses, and kind of in light of what's going on now, horses cannot get human coronavirus, but there is an equine coronavirus which kind of presents itself as a colitis. Horses usually they don't want to eat, they're lethargic, they're a little colicky, and you'll see their manure starting to get really wet or diarrhea. That's kind of what you see with the equine coronavirus. If you get them treated quick enough with anti-inflammatories, some fluids, kind of what we call supportive care, and get them back to eating and feeling better, they have a really good chance of coming through it. But the equine coronavirus bacteria, that virus wants to live in their gut, so they get it just from grazing in areas where a horse that is shedding that virus leaves it in their manure, they pick it up and it goes right to their gut. So you don't see the respiratory symptoms that you'll see in people with coronavirus. So, and minis are actually very susceptible to coronavirus. And there was an outbreak up by Cornell University where a lot of minis died. They were just very sensitive to that virus. So if your horse seems a little off, that manure is a little looser than normal, they're not acting right, there's a quick test for it, but get your vet out. And I'll say this later too, but if your horse has a fever, if they have diarrhea, especially just one of them doesn't seem right, try and put them in a different paddock till you know what's going on, or try and keep them in a stall by themselves just until you know what's going on, so that you're not risking your whole herd. Especially if you've got one or two horses that are going to shows, and then you're coming back to a property where you've got some older horses or you've got some young yearlings or foals, that could be a little more of a sensitive population. Things are off feed or lethargic. It's kind of a mixed bag. It could be that they're colicky or have a colitis or a virus, but just kind of be in tune to that and communicate with your doctor. Fever is another thing. Fever could mean anything. You could have a fever with Lyme disease or with anaplasma, or you could have a fever with pneumonia. Fever could accompany anything. A fever could accompany equine coronavirus. So that's why knowing your horse's normal temperature is great, because if they start to feel off, first thing you can do in your little arsenal, I'm going to take their temperature, I'm going to check their heart rate, and that in and of itself with those other observations can at least give your vet something to start to work with. Respiratory distress, if your horse is breathing heavier than normal, even breathing heavier in work, if they're just standing there doing nothing, you see nasal discharge, especially if they have a fever. It could be anything from asthma to pneumonia. So in our foals, we worry about rhodococcus, which is a bacteria that goes to their lungs and can be very hard to treat, and it forms abscesses in their lungs. So if you start to see their breathing pattern is abnormal, you can hear them like breathing heavily, get them checked. Neurologic conditions, it could be, I think EPM is really high on everyone's list if they start to see their horses off or not coordinated with their gait. They pick EPM up from, it's a protozoa that they pick up from possum manure. So whereas possums are great for the environment and they eat ticks, and you don't really want them in your pastures because they're going to defecate. Horses then graze where they had defecated. They can pick this protozoa up and it gets into their spinal cord. It can be very easily treated if it's caught early enough, but if you start to see them, walking like they've had a few too many glasses of wine one night, or just something's not right, get them checked. Foaling issues. I don't know how many people here breed, or does anyone breed or have foals? I mean, what's that? Used to, okay. Or if you know people that still breed, I mean, like, know your mare. That's like a whole different talk, like foaling and bear work. But, if the mare goes into labor, the foal's not out within, 20 to 30 minutes, you need to have a plan to get them somewhere where they can get that foal out. It's a big emergency that we see during our foaling season, which seems like has lasted into August. It's like the never-ending foaling season, which is okay, but foals are cute, but they're very labor intensive. So we usually appreciate a couple months of a break before we get them back in. And then, like, once again, if the foal took a little bit longer to get out, or if they don't, they could have a little bit of brain damage from lack of oxygen, or they don't nurse well, or the mare's, that first milk isn't good quality. Sometimes they don't get enough antibodies, which they should get from the mare. If the mare is vaccinated appropriately, late term gestation, if the foal doesn't get those good antibodies, then they're not going to be, they might not thrive very well out of the gate. Let's see. And then the few other comments, like I had mentioned, if your horses are sick, try and keep the sick, ill ones separate till they're evaluated. If you can do it without stressing them, because, stress is another huge factor. If you're taking them away from their one and only best friend and all they want to do is scream and run, you might have to modify things, but yeah. But if you can keep them kind of in a little separate area until you can get them figured out. That would work. Good preventative care. It's going to help you in the long run. It's kind of your best insurance to keeping your horses healthier for longer. You know, a lot of us, like, I mean, I can get vaccines through work. Some people can get vaccines, most of them through even Tractor Supply. I still have a vet come out every year and like just go over them, give them their vaccines. You know, if they need boosters, I can do that, but I still want, I mean, I'm an educated eye, but I want a veterinarian to look at my animals every year and make sure I'm not missing anything. Doing fecals, there's a lot of resistance out there to dewormers, and what they're trying to do is kind of get people to deworm a little bit more based on your horse, your environment, because some of them don't need to be dewormed as much as they are. Some might need a different deworming protocol. So by doing a fecal every year, you can kind of work with your vet to come up with a plan that works better for you. Yes.
Isn't it kind of quarterly you give the shot or the wormer?
In some cases, yes, but in some, I know some people that have to deworm 6 times a year. I know some people that have low shedders that they only deworm twice a year. They're trying to get a little bit better with not overdoing it, because some animals, exactly, there's a lot of resistance out there, which is why your deworming schedule does fluctuate. If you might give ivermectin and you give panicure, things like that, so that there's not as much.
They say to rotate, don't they?
Yeah, rotation is good, and if depending on
What would
whatever.
you advise? Every 6 months or quarterly?
I advise getting fecals checked at least once, if not twice a year. Like, and my vet gave me a protocol for mine based on, because I have a quarter horse who's a very high shedder. He gets done quarterly. My ponies are very low shedders. They get done 3 times a year.
Can you take it into your vet?
Yeah. A lot of times you can just do a drive-by, say here's a present.
Here's his name.
Yeah.
And there it is. Give me a call.
Yeah, if you bring it in, I advise, Agar Lab has taught us to put it in like a Ziploc bag or something that seals really well, because sometimes some of the bugs could be killed off by the air. So, but yeah, I mean, it's super inexpensive, and it might save you a couple boxes of wormer depending on how many you're worming. So, because I mean, I've got 4 ponies and a horse. I mean, I don't have to do the 4 ponies. I don't have to do them once a year, so that saves me some money. So, yeah. So sometimes, you know, it's not all about money. It's about making sure your animals where they need to be, so that they don't build up a resistance.
Just doing it right.
What's that?
Just doing it right.
Yeah.
There has definitely been a change in protocol. That's the bottom line.
I had a friend that said that she thought her pony died of is it Quest wormer?
Yeah, some
Quest is hard on them.
Yeah, some breeds are more sensitive. Like, yeah, I don't.
Quest is the one.
Quest I would not give
The
to my
one where you
ponies.
really have to do a measuring tape.
Yeah.
That it says it right on the box. You can really make a horse sick if you give it too much. So you have to take the time to measure the weight and give it. Because the other thing is, Quest, the tube is up to 1,500, whereas all the others are 12. So if you're just used to saying, "Oh, I'll just give the tube," isn't that right? That's when the horse gets sick.
And it's just one other reason to like just come up with a protocol. Like, just have your fecals go in, and my vet literally said, okay, you've got ponies, they're more sensitive to things, like Quest. So this is what I want you to give. I mean, not necessarily telling what brands, but use ivermectin this time of year, use a panicure this time of year, the fenbendazole. So yeah,
Quest also had a problem very early on when it first came out, and it got a really bad rap then. So that rumor really has not left the product, even though the product has had improvements over the past 10 years. So it's a lot safer now than it was when it first came out. But definitely with any wormer, you always want to know the weight of your horse, especially especially for drug medication, in addition to your wormers, you want to make sure that you have your baseline of that, so that you do give the proper amount. And the other thing too is, I don't know about you, but I've worn more wormers sometimes than I've gotten in my horse. So I always sort of, I'll dial it up just a little if I know I've got the bad actor on board. So just know what your, know your animal well enough and know your.
Yeah, it's a very good point.
This pony died 2 years ago.
Okay.
It was her son's pony, Santa Nelson,
Oh.
and she attributed directly to Quest.
I mean, and usually it's hard to, like, if they have an autopsy done afterwards, I mean, then, like that, they can usually do testing to determine, yeah, but some breeds and some of the smaller ones are more sensitive.
And
Like
age
questions
too. Like I
ponies.
gave it to a Clydesdale thoroughbred who was like in her 30s, and she got colicky from it. But she ended up needing Banamine in advance of giving it,
Yeah,
and so she was fine. But I didn't give it to anyone.
yeah. But all good points, and I would just go by your doctor's recommendation, and they'll just tell you, okay, this is what your schedule should be for the year. We'll check a fecal again in 6 months or next year. We'll see if you need to stay on that same.
And it was a large
Cycle.
pony. It was not small.
And the other thing, which is good too, I don't know how many people have like cattle or goats, but if you've got multiple species on in the same paddock, that helps with parasite resistance. Because my guys used to stay in the same pasture with a cow and a steer, and his fecal egg counts had never been lower than when I moved him back to a field with just horses. It really helps with resistance. So yeah, so getting fecals checked, good deworming practices, going by your fecal, getting dentals done, especially as horses are getting older, looking for signs of quitting. So that's like when they look like they're eating, they're chewing up, and they're maybe spitting out hay. So if you go in to do their stall, or if you're in their field and you're like, what is all this balled up hay doing here? That could be a sign that they've got a problem with their mouth. Sometimes even nasal discharge could mean a sign that they've got a bad tooth. If you see any swelling around their muzzle or their face.
Also, saliva coming out. And my granddaughter, 7, said it's from eating clover.
Well, now they can get grass, like clover slobbers. I think a lot of horses have that this time of year. So yeah, so excessive drooling like that, if they're out on a lot of clover, it could be. But if they're actively like chewing and spitting wads of hay or grass out, I mean, and certainly yearly, and even with some of these older ones, like my old paint, has his teeth checked twice a year. He's lost a few teeth. Luckily he's still able to graze, but some aren't as lucky. They need to eat alternatives, like Aaron's horse eats like the chopped up, like Denji type hay, because sometimes they just can't grab it on their own, or they just need something a little softer. They can't chew the stemmy hay. Hoof care, I think we're probably all doing that, depending on your horse's needs. Having a Coggins pulled we have those of us who are actively competing and taking our horses everywhere to have Coggins every year. Even if your horse doesn't leave the farm, they still recommend every 2 years. Equine infectious anemia is something that's spread through the horse fly and mosquitoes, and it's horse to horse. So if your horse is luckily this disease has been, I don't want to say it's eradicated because it still pops up, but there's no treatment for it, but the management of it has been good enough that we really don't see it, or if it is seen, it's seen in little outbreaks. But sadly, the only real treatment is euthanasia. Because you would have to quarantine specifics for a horse that is positive for equine infectious anemia, which is what you're testing for in Coggins. The quarantine is so outrageous. It's really not how a horse should live. They can't see other horses. You have to have netting. They have to stay in a confined spot. They can never go out and graze. But the state has control if they do have a positive Coggins, and the state has authority to tell you that you're going to euthanize your horse. So, so it's really important to screen for that so we can keep everyone healthy. As horses get older, you know, a lot of times they're offering, like some places are offering wellness packages where with your yearly vaccines, you'll get a fecal done and maybe some blood work.
That's a new thing.
Yeah.
Yes.
But it's great, and it's very helpful if then they end up coming in the hospital. As horses get older, you know, kidneys can start to have a little bit of dysfunction, or the liver. Like, you know, one of my ponies, I had blood work done, and it actually indicated that he had equine metabolic disease. His blood sugar was super, super high. So then he's being treated for that. But it is good to have a baseline, you know, and that way if your horse does get ill, they know what that normal was. I'm not saying if you have a young, healthy horse that you need to run out and do that, but if your horse is like 20, 25, starting to slow down a little bit, I mean, these tests aren't super expensive. So, monitoring weight, and then, yeah, just changing diet based on their aging, their dental status, metabolism. You know, that same 25-year-old horse that's not doing anything probably doesn't need 2 pounds of sweet feed twice a day. You might think about switching them to a senior feed. It's a little bit easier for them to process, you know, has a little bit more fiber, not as much, and a little more fat, not as much protein, and things like that. And then vaccines. I'm not going to go on a huge soapbox of vaccines, and there are certainly core vaccines in the area. Rabies, tetanus, flu rhino, which is going to protect against, you know, the rhino part of that is the herpes virus. Eastern and Western encephalitis, which a lot of these are in combinations. Your Eastern, Western, flu rhino, tetanus, West Nile. Botulism is something you should vaccinate in endemic areas. I will tell you that this is an endemic area for botulism. Botulism and tetanus are very closely related. They're both those clostridial pathogens, and they live in the soil. Usually they're going to acquire tetanus. Well, they can acquire tetanus or botulism from, you know, say they get a cut and the spores from the soil will get into their cut. Botulism, you tend to see a little bit more from them eating contaminated feed, either feed that's spoiled, or we tend to see some in a lot of the farming communities where they have cattle, some of the Amish communities where they've got silage for their cattle, and maybe the horses are intermingled in that area with the cattle feed. But the vaccines for especially tetanus and botulism are very, very good. This year has been kind of an unprecedented year, and I don't know if it has something to do with the climate this year, but at work, Aaron and I have seen 3 horses with tetanus so far this year. None of those, one was a foal and 2 were adults. None of them survived. And watching a horse die of tetanus is horrible when there's a very cheap vaccine out there. So tell all your friends, you know, definitely vaccinate for tetanus, definitely vaccinate for botulism. Tetanus causes a very rigid paralysis. You know, you probably heard people talk about, you know, like a sawhorse stance. They get really rigid jaw muscles. They're basically stiffly paralyzed. They can't move. They get very reactive. Their flight response is a little more activated because they're scared. They can't move. If they try and move, a lot of times they'll fall. Botulism does the opposite. They can't move. They're paralyzed, but they're very limp. So both are extremely intensive cases to manage in the hospital. And you could pump, I mean, I've seen people pump $8,000 to $10,000 into these animals for weeks, and they usually still do not have a very happy ending. So that's my only soapbox, and just because I've seen 3 of them, I mean, they're not my horses, but we get very attached to our patients, and it's not good to have a horse down that you've got to turn every couple hours, that can't eat, can barely swallow, and it's all so preventable. So I know there are a lot of people out there that don't believe in vaccines, or they want to go light on the vaccines. I mean, you don't want to put anything into your own body or your animal's body that, is, toxic or not pure. But these vaccines are very safe, but very, very effective. And the area that we're in, Clostridium lives in the soil. It's not killed off. It doesn't get cold enough or hot enough, even though it might seem like it. It just doesn't go away.
Is there anything for EPM?
There's not a vaccine for EPM yet. The best prevention is just to keep the possums away from your farm. I know that they've been...
How about groundhogs? Do they carry it too?
There's speculation that I've heard skunks and raccoons. I don't know. Did you hear Aaron? I don't think it's necessarily groundhogs, but there are a few more.
I've never heard of that.
Yeah, there are a few other species that they've linked shedding to, and I think skunks, raccoons, but they're like low on the list. But the possums, I think it's just from their environment, or I don't know if it's something specific about them as a host. They're really what they've isolated the most of it from. There are vaccines out there for things like strangles and Potomac horse fever. The Potomac horse fever vaccine isn't, a lot of veterinarians aren't pushing that as strongly as they used to, because that vaccine might not necessarily be as good as it once was. But talk to your vet and see what their recommendations are, especially for your area. I know this driving club, we've got a pretty broad area. And if you've got a breeding operation where you're breeding and have a lot of young animals, you might want to vaccinate for strangles, because they're a very susceptible population. If you've got a bunch of older horses, or animals that aren't leaving the farm a whole lot, you might not need to. But come up with a plan. A lot of these are just yearly vaccines. Some of them, if the horse hasn't been vaccinated before, you might need to do a few boosters, and then they're yearly. Or like flu rhino, it should be done every 6 months. And then I'm gonna kind of wrap this up with some biosecurity talk. And basically, a lot of these you're going to read and be like, well, this just seems like common sense. A lot of biosecurity is common sense, which is the definition of common sense. I think it's kind of broad. But it's not to say, like, sometimes you just don't think about this stuff. And, biosecurity is a word that I've used every day, even before the whole world was using it for COVID. But it comes down to just stopping and thinking and kind of be practical on your approach. And this is something, like I said, I do it every day in the hospital, but you can be practical about it, because we're all going to shows and we're all exposing our animals to things that they're not used to. The whole term biosecurity just means that you're protecting humans and animals against harmful biological agents. Biological agents is just everything that lives, natural things that live in the environment. Our goal is trifold. We want to protect ourselves, because some pathogens that horses or other animals we can acquire. So if they have diarrhea, you have to be careful, because what if it's salmonella? You could acquire salmonella. So things like that. E. coli. You just need to be careful about some things, because you don't want to get so sick yourself. You're not going to get strangles from them. You can't get their coronavirus, but you can get some things. Rabies is very rare. You could get rabies. But knock on wood, we don't see that a lot. We want to protect our animals, we also want to protect other animals that we're coming in contact with. So it's important because horses may not seem stressed in our sense of stress, but even going to shows or going to pleasure drives, going on trail rides, having a new horse show up at the barn, any of this can and will stress your animal. You may not see it overtly, but it can stress their gut. You might notice they're not eating the same. It could lead to things like gastric ulcers. But that stress, especially if it affects their, like I use the GI tract a lot as an example because I deal so much with it. But if a horse is off feed or not eating from, say, colic, a lot of all of us naturally have a little bit of E. coli bacteria, some salmonella that naturally lives in our gut, but it's kept at bay by all the good bacteria in our gut, which is why if you're on antibiotics, people talk about having probiotics. You know, it kind of helps the healthy bacteria stay happy. But if for some reason they're off feed and there's a little rumble with the bacteria, then sometimes they can start shedding more or proliferating the E. coli, the salmonella, and things like that. So kind of keeping track of your horse's stress and kind of trying to manage it is important.
Did you also say temperature change?
Temperature change can certainly be indicating or can indicate that there's an issue. But just, and some people will, for ones that seem to get stressed to the point of ulcers, like you can give like ulcer guard or preventions over the counter. You know, some horses when they go away they get stressed, they don't drink, so sometimes you have to bring your own water. But some may seem like they don't care and they don't care. Others may feel it but not show it. But they're sensitive creatures, and my horse got aggressive when he developed ulcers. As you know, what kind of stress he had in his life, I don't know, because he lived in a field with a pony and didn't do anything, but like I rode him once every 3 months. Like, I don't know how to take any more stress out of his life, but he had ulcers. We treated him. His life was much better. I was poorer, but he was happier. So, and then just other tips for people, you know, bringing new horses in. About 2 months ago, my sister called me from New Holland auction, like, hey, there are 2 horses up here. And I'm like, that's great. Keep them there. We don't need any more. You don't need any more. And then I get a picture about a half an hour later, and I'm like, and she's like, so are you close to the trailer? Because I didn't bring the trailer with me. And I'm like, she was going with a girl that was looking for a horse, but she ended up getting this one. So I'm like, well, I'm gonna set the stall up for quarantine. We need to, you know, check his manure, check him for strangles. Like read her the riot act, and she's like, okay. Like, she knew she had to quarantine. Yeah, she knew she had to quarantine him, but I'm like, you know, and luckily we have a separate aisleway with equipment, so he's kept in a stall in a separate aisleway. I took his poop into work, made sure he doesn't have salmonella. We, you know, we scoped his upper airway. We made sure he didn't have strangles, and that has a 2-week shedding period. So he had just ended up at the sale. He could have been exposed that day, but not shown any signs for 2 weeks. So even though he came off the trailer with normal poop, no nasal discharge, he looked fine. I said, I don't care. He's going in a stall for 2 weeks. He's getting checked before he goes out with everyone else, which she was fine with. But you know, in the heat of the moment, you don't think about these things. And luckily, he ended up being fine. And he actually might be coming to Bucksmont, this little organ that she picked up. So it all worked out. But keeping those animals quarantined, keep taking their temperature. And also when you're working with an animal like that, it's, you know, she would do him last before she would leave, have a change of clothes, She even had her own separate shoes for going into that stall. But if you're in an area where you're quarantining something or something sick, you know, changing clothes, doing them last, having designated equipment, even for, he had his own wheelbarrow, he had his own muck tub, and then just keeping things clean, and make sure that whatever disinfectant you're using, like even bleach, we're all guilty of it, I'm sure. I know I am too, of just eyeballing it, but each disinfectant that you use will give you a dilution. Bleach is usually like a 1 to 10 ratio, is really good for disinfecting things. There's a little quote, you know, the solution to pollution is dilution, and just really making sure you don't want to under dilute or have something that's too concentrated, because once again you can build resistance. So and then the back page of this is something that our biosecurity officer had helped me put together for another talk, and it kind of gives you good points, especially as we're heading to shows. You don't want to let your horse come into contact with, even though I'm sure we all have well vaccinated, healthy horses, they're all in different areas. So if I had my pony at a show, I wouldn't want him to, you know, oh, here, come up and smell this horse or meet this horse, because you're just kind of, I mean, there can be behavior issues too, but you don't want to risk them
Social
spreading
distance.
it. Exactly. All horses, luckily their bodies are large enough to socially distance, but you know, just, and you don't, if your friend forgot, you know, grooming supplies or you know, a pitchfork, just clean them off between animals. You just don't need to be spreading any more than you need to. You know, not letting your horses graze in areas where people are disposing of manure, things like that. You know, so it's just general reminders. You know, a lot of these we had already kind of went over through my talk, but yeah, keep your horses socially distant, especially nose to nose and fecal oral. Those are usually how a lot of the pathogens spread. So they don't have a good face mask for horses yet, but
Yeah, God.
just yes.
Mariner East is putting a pipeline down to from Pennsylvania down to upstate Pennsylvania down to wherever.
Marcus Hook.
Yeah, Marcus
Oh.
Hook. And it leaked, and they had chemicals leak into Marsh Creek State Park.
I just read that.
Yeah. Has anybody heard? It's supposed to be very detrimental to the drinking water in the Brandywine and then down in lower Delaware. Did you hear anything at New Bolton about that and what?
I didn't. I don't know if you've heard anything, Erin. I think because they have part of the park is closed, right? I think I heard. Yeah,
in
I have
Marsh
not
Creek
heard
State
anything
Park?
specifically yet, but
They admitted to 10,000 gallons, which
Yeah.
means
10,000 gallons.
probably
yeah.
100,000.
yeah, they said it was 1,000. Then they said, well, maybe it might be 10,000. Now they've shut the operation down.
Yeah,
So let's see, shut the operation.
yeah. It's pretty
So don't take
unfortunate.
your horses to Marsh Creek to drink out of the end of the lake.
Yeah. You don't want to do that. So
I have one question here.
Yes.
Wash hands after touching other horses. Sanitizer does not work. And when you say organic, you mean manure?
yeah, so that's a good point. So hand sanitizer works great if, you know, we're touching things like this. You can, but if you have dirt or if you have manure on your hand, like organic debris, the hand sanitizer doesn't work. You'd have to wash your hands and sanitize after, because it's not gonna wash that off.
Happy birthday, then sanitize.
Yeah, because even when we wash and sanitize,
Well, it's funny because the liquid stuff is in all the porta-johns.
yeah.
So, in other words,
Good point.
you know, it's just, you know, it's a feel-good.
Yeah. I mean, it's
Yeah.
something's better than nothing.
I'm not trying to be funny, you know what I mean?
Yeah.
But
Yeah. But if, like, even with our
it's not that
stalls,
effective.
Yeah, I mean, you want to washing it before using it. Like in a lot of disinfectants, even the disinfectants that we use on our stalls, none of them are effective if there's organic debris. So we use basically a generic version of Tide with bleach to wash our equipment, wash our stalls, and once it's clean, then we disinfect it. So it's the same with your hands. Like if you've just been grooming them, if you've just been mucking a stall, wash your hands and sanitize. But so the sanitizer alone is not effective. Like with us, a lot of times for our procedures, we're wearing gloves for things, so we could take our gloves off, sanitize, and that is effective. But if our gloves ripped or we just gotten a little bit of a mess, you want to wash then sanitize. So that is a good point. Are there any other questions?
Roundup says they make a chemical that kills under fence lines, and it's safe once it dries for animals to eat. Is that correct, or do you know much about it?
That I don't know.
This is the same company that has a class action suit for cancer?
Yeah, I'd be
Doesn't
careful
feel
about
I
like
wouldn't
using
go
any
there.
of-
I wouldn't go there, Lydia.
Personally, we just weed whack around our fence lines. But I
Now,
don't
these
know.
statements are made by lawyers who are looking to save money.
Yeah, I'd be careful about using.
Lawsuits on it.
Yeah, personally, I'd be a little skeptical. So
Salt, vinegar, and a couple drops of Tide in a spray container will knock down a lot of your weeds, and it's not as noxious as some of these other chemicals.
Liquid Tide.
No, it's apple cider vinegar, water, salt, and Tide dishwashing liquid.
Liquid.
Yes.
Or Dawn. That's
Or
just
Dawn,
to help make
yeah.
it stick to things, I think. The soap.
Will it
Do
go
you guys
through the
still have
pump?
any Bolton those disinfecting mats you have to walk on and change your shoes and all that stuff?
So we veered away from the ones that have liquid in them.
Yeah.
Instead, we have, in isolation, we still have dip tubs, but we change a lot of shoes depending on the areas that I'm in. Like if we go into our colic ward, we change shoes. Our isolation ward, we change shoes and change our clothes when we go in with patients. But we have these. The brand name is Dicem, DYCEM, and these are really. If you walk on them, you think they're dirty because they're sticky, but they're mats that are, the science behind it, it's supposed to just like suck the bacteria off your shoes. So when you walk on them, you're like, ugh, something spilled on here, they feel sticky, but they're supposed to feel sticky. If they're not sticky, you question that they're dirty. But yeah, but if you're working with an animal at your barn, I mean, a dip tub with that bleach, like a 1-to-10 ratio or something like that, dip shoes in is fine. We're kind of a whole different ball game because we see so many sick animals that are shedding things, and every once in a while we have to change up our whole protocol because you get resistance because we're constantly cleaning our environment and the bugs just get used to it. And it seems like every 10 years is about how long it takes us to change something up. So we have a whole department. It's a 2-person department, but it's their job. Biosecurity is their only job. They track numbers. We do admission samples on anything that comes in with a colic, any cow or like a food animal because they're more prone to shedding. Certainly anything that comes into isolation with diarrhea, anything that comes from an auction, everything gets an admission sample so we kind of know where they stand when they come in. And then those numbers kind of help us as far as tracking and learning a little bit more about the bacteria. So.
Well, even for biosecurity, like New Bolton has poultry diagnostics, which is down the road a little. But it's the same area, and they like to monitor the backyard flocks. So if you ever question about your chicken and what it died of, they will autopsy it. And it used to be like $35 it went up to now. I don't think it's that much, but it's good to know, and also they like to know what's going on in the area.
Yeah, this is a very good point. We don't treat live chickens, but we do learn
Cut 'em up.
Yeah, we do try and learn something from the deceased ones to
Yeah. If it's your
help the
pet,
live
though, yeah.
population.
They won't give it back though, so if it's your pet, you gotta leave it. You know, so. But it's always good to know.
Yes.
Yeah, on page 1 of your excellent handout here, what does BAR and QAR?
Oh, that's a good point. So BAR, like, this is kind of a gauge is when we're looking at a horse to determine. BAR is bright, alert, and responsive. So their eyes are open, they're bright, they're moving around, their ears are up, they're responding to an interaction. And QAR would be they're quiet, but still alert and responsive, just a little slower. And then, you know, are they dull? Are they just standing there with their head drooped down? They don't care that you're there. So, so yeah, I meant to mention that. Kind of just part of knowing your horse's natural demeanor. Are they that Eeyore out in the field, or are they the social butterfly, the center of attention? So, yeah. So,
Thank you.
yeah. Thank you.
Thank you.